We're here today with Jack Kolk, co-founder of ACR2 Solutions, and we're going to be asking you some questions about automated compliance reporting as ACR2 does it, and
ACR2, Automated Compliance Reporting, was founded about 6 years ago. We started out in the financial industry just prior to the bust, and what we specialize in is information security compliance.
well, we are all familiar with what's happened in healthcare since the HIPAA Act was passed in over a decade ago now, but there's been a lot of other changes as well that have heightened the risk for hospitals and other providers. You want to speak about that a little bit, Jack?
Yeah, absolutely. Under what's called the HITECH Act, a lot of new regulations were put into place, but also the existing regulations got some real teeth. One of the items that has a lot of impact on practices in hospitals was the minimum fines. It used to be the maximum fine was $50,000 down to nothing. Now the maximum fine is $1.5 million, and the minimum is $50,000. So they've raised the pain level in order to get people to realize that this is starting to be taken much more seriously.
I think there's been some significant developments in terms of increasing the risk profile with regard to audits as well, Jack. What's happening there today?
Right. It used to be that one of the reasons people didn't comply with the requirements of the HIPAA privacy and security rules, it's actually two separate rules, was that they weren't being audited, they weren't being enforced. So when you would talk to somebody about the fact that compliance with these regulations was important, they'd say, I've never been asked about it. I don't know anybody that was ever asked about it. The audits just weren't occurring. Over the last 3 years, because of the high tech, there was a period where they started doing some exploratory audits. They did about 125 last year, and that set the framework for the ongoing audit requirement. Right now, Health and Human Services through the Office of Civil Rights has stated that between 5 and 10% of all physicians and virtually all hospitals will be audited every year. Once you're audited and found to be out of compliance, they will put a corrective action plan in place. Once they determine what the level of fine, depending on your level of non-compliance, the amount of the fine will be. So if you're trying and giving a honest effort to compliance, you're in what's called reasonable diligence. If you're not doing anything and all of a sudden you get audited, you're in what's called willful neglect, and willful neglect are the largest fines.
And the willful neglect fines, I think in fact you've recently worked with a client that had fallen off of the pathway and was facing a substantial fine. Is that correct?
Well, we've worked with a lot of different types of clients. As part of our offering, we have single physician practices, dentists, we have multi-physicianal practices, and then we have large distributed practices and hospitals. Many of our clients have been audited recently. We did work with one that had attested under the HITECH Act for the healthcare stimulus funds for adopting electronic medical records. They were found to be non-compliant. Several of our clients, again, have been found to be non-compliant. And as part of that, the payout, the payment that they were eligible to receive, and in fact, in this case, had received, we were able to engage with them, offer our solutions, contest the findings, submit our compliant risk assessment, and in fact, they were awarded their funds back.
But the initial penalty was going to be a recoupment and a payback by the physician group of the money they had received under.
That's correct. Originally, when this program came out, you were able to attest that you had did something without supplying any proof, any documentation, and then the audits came afterwards, and they can request this documentation backwards in Medicare or Medicaid or slightly different, but say for the next 6 or 7 years upon demand, you have to surrender all the documentation that proves that you were in compliance. We have one knowledge of one clinic where 7 out of the 12 physicians have been audited. So it's not the practices or the hospitals necessarily that are getting audited, slightly different in the hospital space, but it's not the practices that are getting audited, it's the individual physicians. And once they find that an individual physician at a practice is non-compliant, obviously they can follow the dots with the assumption that probably the rest of them are in the same group.